Hi, it's me, Ingrid9FP. I'm filming this video after the video about autumn, and I said that I couldn't talk about anything else, but I can actually, because basically where I sat had a bunch of moss, and my whole behind is wet from the moss. So I'm sitting here in a plastic bag and like trying to dry out. Kind of like half kneeling. Anyway, I do want to talk about something that is very different, and that is that I read a book about healthcare, and it's called "Och till akuten" by Fanny Nilsson, and she is a colleague of mine. We don't work together really, but we know of each other, let's just say, because like the doctor world in Sweden is very small. So like also she is somebody who likes debating and who has like written articles or like, you know, being interviewed in the doctors. There's this doctors magazine that the union actually became part of the union finally. I became scared for my job when I started at the medicine clinic. So yes, I'm part of the union now, and I get this magazine every month, which I guess it's the only useful thing I get from the union right now. But she, you know, she's somebody with opinions and that wants to change medicine, and I'm really happy about that. Because not everybody can do that kind of advocacy as she does. But I read her book that just came out, and the book is in Swedish, so unfortunately, if you can't speak Swedish, I'm sorry for you, but a big part of it is about the Swedish healthcare system, but it's also about, she went through Europe and looked at other healthcare systems. So she went to Norway, she went to the Netherlands, she went to the UK. She has a little bit about Italy, a little bit about France, a little bit about Germany, a little bit about the US as well. But she doesn't really go into detail about those countries. But so she talks about how the healthcare system, we have to prioritize because we can't do everything. And there's a certain "och till akuten" means go to the emergency room, basically, which is something that there's this telephone system in Sweden where you call this number 1177. You call them, and they tell you if you should go to the general clinic or if you should go to the hospital. Now that system does not make sense in other countries, maybe, because in some places to go to the emergency room you have to go to your clinic, like in the Netherlands. You're not allowed into the emergency room unless you like are having a heart attack. In some places it's like, well, most things need to go to the specialist, the hospital, you know. So, but in Sweden it's that you call this number, or you can call this number. You can also choose to not call it and to go directly to the places, but then they might say, no, you're at the wrong place, you know. So you call, and then they tell you, oh, because it's hard to decide anything on the phone, then you're told to go to the emergency room, and in the emergency room they tell you, like, why do you come, you know, that kind of problem that's unfortunately is relatable, and unfortunately there isn't really a solution to it. But she went into great detail about all of these systems and how we prioritize different things, public or private, if we like are more focused on prevention or extremely precise healthcare, if we're focused on the few people that have very deadly but very uncommon diseases, or if we focus on the most common diseases, or if we focus on paying the doctors per operation, or if you pay the doctors by just how many people they have worked with, or you pay everybody the same standard salary. There are all sorts of different things that she talks about. She talks about digital care. She talks about, how general practice medicine is very different in Sweden, where in Sweden the general practice doctors are placed in these centers, the clinics, and sorry, this insect went right on my mouth. But so it's a lot, and I think that her book is good for the layman person, but it talks a lot about economics, and it is kind of difficult to hang with that, but I think it's a very good book. I agree with most of the things in there. The only thing I don't really agree with, I guess, is that she doesn't go into detail about how overworked a lot of these general practice doctors are in other countries, and how in Sweden general practice doctors have it good, but that we shouldn't give away our rights just because they do it differently in other countries. There's a reason I left France to go to medical school. Several reasons, right? But one of the reasons is that I knew that the working conditions were going to be better in Sweden, and they definitely are. A GP doctor does not meet as many patients per day, but I have a normal work day instead of working 80-hour weeks. I can work a 40-hour week approximately and be paid fine. But that's not the case in other countries, and general practice doctors, in France you are independent basically, so it can be good or bad, but if you only get 25 crowns per visit, it doesn't turn out to be a lot of money, and that means that you have to do a lot of visits in order to get just the minimum wage, because there's so much money that you need to spend on administrative stuff, so it doesn't really, it balances itself out, So anyway, I read that book, and so I see all of the problems with the Swedish healthcare system. I see all of the problems, but I think that there are a lot of people out there, and I'm not talking about a single person here, okay? If somebody feels like it's directed towards them, it really isn't. I'm just talking about patients in general. This is my job, so obviously I'm going to be hearing everybody's ideas on healthcare possible. My family, my patients, everybody in my life talks to me about what they think of the healthcare system. When people in the comments here on my YouTube videos, I've decided against that in the future I'm going to try to not get into any discussions about the healthcare systems in comments on other people's videos, because I have gotten into arguments that there's no right or wrong. I can just say how the system is now and what is possible within the system. I can't say how we might do things, because I'm not politically I'm not a political advocate. Oh wow, what is that plane? I don't know if you guys can see the plane. Anyway, that is quite scary. Okay, that might have been a military plane. Once again, how do we use our money? I mean, Sweden is very scared of Russians coming, so there is all that. But anyway, we have to decide where to put our money and how to invest it. And the thing is, the people who make the decisions are not the people who are actually working with healthcare, And it's a big problem that doctors like me don't want to go into leadership or into like political roles. I know of a few doctors that are like politically engaged and stuff, but I find that politicians are often don't really want to listen to doctors and nurses and nursing assistants. Twice politicians have come to listen to us basically talk. In my career, I've seen twice, and they've never asked the right questions, and they've never really listened to the answers, and they really just do a lot of this for the PR, and they're not really invested in like reforming the healthcare system, because like for them it works, right? But how does it work for, you know, the people who are extremely sick, the elderly, the people who are you know, poor and who can't afford things? You know, these politicians are often not in that category and don't have empathy for that category of people. You know, I'm speaking generally. Obviously, there are probably some politicians that are. It's just that this is what I have seen. And I just work within the system, and you know, that's a dangerous line to have, to say like, oh, I'm just doing as I'm told. You know, you know, during wars, people have said, oh, I was just doing as I was told, and so, you know, but it does lead to a ethical stress in me. And who was it? It was Hank or John Green who just made a video about moral stress. In Sweden, we call it ethical stress. There was a lot about that during COVID, where it was like, well, you have to do these prioritizations that you shouldn't ever have to make, you know, between people there are so many people who are dying, but you only have a certain amount of intensive care unit spots. What do? You know, all of them deserve to go into intensive care, but you only have 2 spots. You have 3 people, you have 2 spots. Who deserves the spot more? And there will be different kinds of prioritizations, you know. Should the elderly person get it because they are more sick and therefore would have be most in need of it because there's a risk of them dying? Should you put the child in there first because they have most years left to live, and it's such a tragedy when a young person dies, so many years that you could have that you are lost? Should you you know, give the person with these comorbidities or without the comorbidities? What are the chances of them surviving the ICU care? It's a huge thing, and I don't have the answers, but it's something that I have to deal with every day, you know. Maybe not to that dramatic extent because I work in general practice, but right now I'm in internal medicine, and there are some prioritizations that I have to do, you know, like okay, this person should probably stay at the hospital, but now we have this new person coming in that has need of hospital, and somebody needs to be kicked out in order for us to have this new person who is very sick. And it's awful to have to think that way, but that's how I have to think, you know. Also in general care, there are certain things that patients want something, and I cannot give them to them because of costs, because I work in public health care and I cannot, you know, certain treatments, I cannot do the cost. A lot of times, it's even on small things like patients want me to take their vitamin D, a blood sample for vitamin D. But if I said yes to everybody who wanted their vitamin D taken, it doesn't help. What we work with is what we call choosing wisely, which is like basically you have to choose what is going to help in the treatment plan, you know? How are we going to get further into the treatment plan? And taking a vitamin D that is going to be low anyway, and the vitamin D in itself, there hasn't been enough evidence to show that vitamin D makes you tired. Like low vitamin D makes you tired. That evidence just does not really exist. And I'm saying this as somebody who, my supervisor, okay, I'm kind of biased because I used to think that, vitamin D, lack of vitamin D makes you tired. I thought this, truly. But my supervisor actually did his PhD project on vitamin D. So, yeah, he doesn't believe that vitamin D is the problem. It's not wrong to supplement with vitamin D, but every time that I write a prescription or take the blood sample, it means that I need to, that I'm spending money, and that the patient, and also like the patient can buy vitamin D tablets without me prescribing it. So unless the person has osteoporosis, like their bones are not strong, I'm not prescribing vitamin D. And yes, sometimes I do it anyway, because like I can't deal with, I feel like, I'm being so cheap, not giving people the vitamin D. But like, sometimes it's just tough to have to say no to people. And I have to, and so sometimes I give in and I prescribe, the vitamin D tablets and stuff. But but that's not how, I'm pressured. I have pressures on me to not do that, And if me saying no to a vitamin D can help another patient who really needs the vitamin D, then I'm going to choose to say no. But it's such a simple thing on the surface, but I have to make these kinds of decisions many, many times a day. And so obviously, yes, it is affected by my mood for the day, also my own values. Different doctors do different things, but we all are part of the same healthcare system. So, I need to help the system save money, while at the same time I need to treat my patients. And there's a whole other thing as well of the more prescriptions, the more examinations you do, doesn't mean that you are coming closer to what the patient has. Sometimes examinations just give you red herrings. Sometimes they give you, they show things that are normal, but now you have to do even more examinations. So, sometimes we find things on x-rays that are actually just part of normal human anatomy. But the thing is, you can't say that it's not cancer until you've done another x-ray in several months' time. So it means that because you asked for one x-ray, then that inadvertently you actually needed to do 2 x-rays. And it's like, if you hadn't done the first x-ray, then yes, you might not have found what you were looking for, but you need to have something that you're looking for as well. When you do every kind of examination, you need to know what is it that I'm looking for. You can't do an x-ray without knowing exactly what you're looking for, because there are a lot of people out there in the population who just went to do an x-ray to see if there's something strange. And it's like, yes, the x-ray will find strange things with you. It finds strange things with everybody, For those of you who know about scientific stuff, the sensitivity, the specificity of each method, it's hard being a doctor, It's like I have to say no to people who want these things that I understand that you want to know more. But I can't. I can't do that. Because if I do that for you, I can't do a special exempt. You're like, I can't do an exception for each person. And at the same time, I want to treat, like, every person is an individual. And I can't just follow a guideline, and just do the guideline. I also found out through the book that if all the doctors of Sweden were going to follow the blood pressure guidelines that are national, basically you would need every single doctor in Sweden be working with blood pressure, and every single medication, like everything in healthcare would have to be about blood pressure in order for the resources to match the how stringent the regulations are, And so that means that the doctors don't follow the regulations. I can't follow the regulations. Also, I live in a place that is not Stockholm. So in Stockholm you can do all sorts of different things, which you can't do in my region that is more rural. And the people who live here understand this. But some people who have lived in Stockholm beforehand, like me, don't really understand this. Because it's like, it's unequal. It's unequal healthcare across different places. And that's awful. Because I realized that if I were in Stockholm, I would be sending people to many more examinations than what I'm doing now. And I also would have less experience in treating certain conditions myself, such as heart failure. I can treat heart failure. I have no problem with that. It is a little bit complicated once you start getting into many medications, and I might not need the help of a cardiologist. But I know what kind of medications to take. I know what to monitor. I can deal with it. But in Stockholm, I would have to send a referral to do a ultrasound of the heart within 4 weeks, I think. And in my region, you can only get one. If you're lucky, you can get it within 3 months. So I cannot follow the recommendations because we don't have the resources for it. So it's one thing following the recommendations. The other thing is individualizing the medicine. But you can't individualize too much because you do have to follow certain rules. Because otherwise the healthcare becomes unequal. Certain things are expensive, but sometimes I will do them if I find that I need to do that in order to get further with my diagnostic process, But yeah, a lot of people go to private healthcare in order to get these things, but sometimes the private healthcare does not have the competence within their, they don't have the rules or regulations that means that they have to have a certain kind of competence within their group. So a lot of times I'll have people who want to do all of the blood tests, and they will go to a private clinic and do all of the blood tests, but then nobody will be there to explain what the blood tests mean. And so, it's kind of like getting a genetic test sent home to you. It's like, how do you interpret it? And somebody who is very worried might think, oh, I have 70% of a risk of getting Alzheimer's in the future, and then their whole life is worrying about getting Alzheimer's, when the genetic risk, okay, we can't know. You might be in the 30% that does not have Alzheimer's. And it's it's hard when people want to know more, and I can provide with my expertise of trying to explain the results of the test that they got, but I cannot justify like giving all that, you know? And there's so much I have to do. There's so much. And it just keeps being more and more put on the general practice doctors. While primary care keeps getting less and less money. So I basically, like, my boss is trying to figure out ways of making more money because more and more people are leaving my healthcare center to go to digital healthcare apps, because like they get what they want on the digital healthcare apps, and like I understand. I also understand that there's not many times at the general practice, so like somebody might have to wait several weeks before getting to meet their doctor, and that is terrible, you know? But at the same time, they also want to meet only the same doctor every time. And it's like, well, what if the doctor is sick? You know? You can't have it both ways, unfortunately. You can't both have your doctor and have a time very quickly, you know? Unless the doctor only takes acute times. You know, it's like, you need to have planned times, acute times. Either you focus on having quick times and having a different doctor every time, or you have slow times and it's the same doctor every time. But that same doctor might be overworked and also might need several different, like, you know, maybe the time with the doctor will have to be shorter if you want to have more visits, you know? And having 15 minutes per patient is okay if it's like, you know, I don't know, a urinary tract infection, something simple. But if you're somebody who, like, you know, has several different conditions or some mental health condition, you know, doing it in 15 minutes, that's not going to work. So yeah, I have a hard job, and I get to hear all the shit that is put on us. I think that the nurses get to hear much more of the shit, actually. But I get to hear a lot, and yeah, I can't do anything about it. And I can only do my best within a system that is dysfunctional. And yeah, so I will have different opinions than everybody else because I am a doctor and I happen to work within the system, and that's like a huge part of my life. But I see people in YouTube comments on my channel, but also on other channels, having a completely different view of what doctors should be able to do. And, you know, and everybody has a right to be angry about systems and such. Because, you know, I'm angry about the system too. But sometimes I feel like people will recommend each other in the comments, like, oh, you should you should ask your doctor to take your vitamin D, or you should ask your doctor to do a scan because it means this. And I can't compete with AI chatbots, you know, because AI chatbots don't work within the healthcare system. They work in their own way, you know, and I have limitations because I'm a human. I'm a human being, and I work within a flawed healthcare system. But I'm doing my best, and I think that a lot of people forget that. And sure, there are bad doctors out there, and I've met some of those bad doctors, but I try to, you know, be there in good faith, you know, and hope for the best. And sure, there's a lot that is shitty, and I also have had terrible experiences with doctors. But I went to, I went some recognition out there that sometimes the doctor is just trying the best that they can. I don't know, during COVID there was like, I'm not saying that everybody should like clap for their healthcare providers, but like, there are actually people working within the system and they're trying so hard. And people, like I see my colleagues, circles under their eyes, they're dealing with extremely difficult cases that several doctors have talked together and nobody knows what to do because it's so difficult making these decisions. And I find that, and real life isn't like in the series. And sometimes I feel like the people in the series get more recognition than the actual healthcare providers. And I think that maybe healthcare should be placed on a higher level of importance in terms of political questions. I just watched an interview of Trevor Noah with interviewing Bernie Sanders. The whole shutdown of the government thing. I hope that by the time this video comes out that the shutdown of the American government has stopped, because like I have cousins that work for the government and I don't know if they're getting paid right now. But like it needs more funding and more smart funding. And what I mean by that is that a lot of the money that is spent in healthcare is not spent in a smart way. And if it was spent in a smart way, then we would be able to do much more. Also, we need to figure out, like, what is a good, healthy life? What do we want to focus our medical expertise on? And I think that a lot of people would agree, if they actually thought about it, that primary care needs more funding, and that a lot of this very specialized, very advanced medicine is great and all, and it has saved many lives, but we can't keep on giving more and more to that kind of treatment to like rich people. We need to provide basic health care to people who are in need of it, and that's why I chose general practice. Not because I'm Mother Teresa or whatever, but like I am interested in helping the people that of all kinds, and not just the very few, and to actually make human connections with people very earth face to face, rather than having very distant connection to people. So tell me what you guys think. It is a political discussion because healthcare is politics. Everything in society is affected by politics, and I can't just like run away from the question of politics, because it does affect my life and it affects everybody else's life too. So that's what I had to say for today. Also, I do want to remind people in the US that even like socialized medicine has its flaws, right? It's not completely like a utopia. At the same time, also a lot of people in the US have an idea of like how socialized medicine is like basically that you have super long waiting times and whatever. But like you know, the waiting times is not that much worse than in the US, I don't think, you know? Uh, it depends on how much you're willing to pay. That's the whole thing. So I would say that socialized medicine is better, in my view, compared to the American system where everybody has to pay out of pocket and pay all these insurance companies. But socialized medicine is not, you know, there are many different kinds of socialized medicine and they all have their problems, and a lot of European countries that have socialized medicine, and even countries outside of Europe, are having their difficulties, you know? And so we should learn from each other rather than, like, you know, saying that this is the way that it has always been, you know, and giving up. We should learn from different countries and from each other, you know? So yeah, have a great day, everybody. Bye.